Therapists Without Borders. This is an overview of the Respiratory Nurse Certification Course run by CCNAN, scheduled for July 16th to October 13th this year. That's in exactly 2 months, but there's still plenty of help required to make this a reality. So here goes the plea. RTWB is how RTs show that we care. We've been doing this since the beginning of our profession, but this is a charity that was started in 2014. It exists to improve respiratory health through educational advancement of local healthcare providers worldwide. Our goal is to improve respiratory health. Our charitable mandate is to advance education, and we achieve this through local healthcare providers. So how is it that we work? We work exclusively through healthcare education partners. We believe that these are the local experts that provide reputable intel with ideas as to how we can best improve respiratory care. A formal needs assessment is done to confirm the respiratory education need that can be filled within the RT scope of practice. One of these HEPs, that we call them, Healthcare Education Partners, that we added this year is the Critical Care Nurses Association of Nepal, CCNAN for short. They are a local NGO established to improve the level of critical care in the country. Currently, they have over 200 members, and their training capacity is over 30 per year. I think this is a slightly outdated numbers. But in terms of the progression of the nursing career here in Nepal, they do a bachelor's of nursing. They're hoping that that will be the baseline practice. And they have a critical care nurse training program, which is a 3-month program. After that, there's a critical care nurse instructor training program, and that's 6 months. But now we're adding something to it, the Respiratory Nurse Certification Course for graduates of the Critical Care Nurse Instructor Training Program to take. And this is a 3-month course. And following that, we'll be doing the instructor course for that, which is another 6 months as well too. The end goal is to have 1 RNCC grad per ICU, and there's about 450 ICUs in the country. So the Respiratory Nurse Certification Program, RNCC, is going to be a 3-month course that's available for critical care trained nurses with 2 years ICU experience. It's an open source course, so we'll have lectures online. It's also a global collaborative, so we're hoping to get faculty from all over the world contributing, experts in the topics of interest. So the first 6 weeks, the first half of it, is didactic sessions with 180 presentations and 120 skill labs. We currently have 178 presentations to go and 119 skill labs to go. We also have a 5-week clinical rotation that will be done. And so this will allow them 20 shifts, 20 12-hour shifts. And then the last week will be presentations and a final exam. So the question that we all have is, how can we help? So there are 178 presentations left to go. In terms of what needs to be done, it's a slide deck and then a 20-minute video that you would record, and submitted with that should be 5 multiple choice questions and 2 discussion questions that can be led by a facilitator. We're hoping to bring the instructors on in the next year, so they'll be able to facilitate these. There'll be also 120 skill lab sessions, and worksheets need to be developed for that. The clinical preceptorship, if you happen to be in Nepal at this time and have current practice registration, please speak to me, and we will try to get you licensed so that you can be a preceptor for students during this time. So thank you very much for listening, and we hope that you will be able to get involved in some way, shape, or form. There's a Google form that I will send a link to. You can always feel free to email me, and please share with others what your professional charity is doing. Thank you for the opportunity to partner with you in improving respiratory health through educational advancement of local healthcare providers worldwide.